Is Rose Jenga, and in today's video we are here to talk about women and alcohol, just to understand the health risks that go together with alcohol use in women. The number one thing that we need to understand is that alcohol, when it gets to our body, it is connected to the water mass in our bodies, which in women it's less. We do have less water mass in our bodies than men. So if a man of the same weight and age drinks the same alcohol with a woman of the same age, the concentration of alcohol, or what we call the alcohol content in the woman, will be more higher than the man's concentration. So with that being said, there are more health risks for a woman who drinks the same as a man, either of the same age or the same weight. And for that reason, we just need to think about what are these health risks. The number one health risk of women who drink alcohol, and to understand, this is when mostly we do have a woman who drinks 3 drinks per week, has 15% higher risks than a woman who does not drink at all. So the number one thing is about the medical emergencies and deaths that occur with alcohol use. And the reason behind that is because of that concentration that gets in our blood system, in our body system, when we drink the same amount of alcohol with a man who probably sometimes compared, we are at more risk of having issues with health issues and also medical emergencies, as this is more said to road accidents because of non-concentration and other kind of stuff, leading to more visits to the emergency due to any injuries caused by these accidents or death. The other thing is alcohol use disorder. When we talk about alcoholism, it gets to a point whereby people become dependent to alcohol as a daily use or for them to function. We can tell and we can attest that women are less likely to seek medical attention when they have alcohol use disorder. If you think about it, even in the rehab, we see men seeking more help compared to women. That means that women hold onto it even when they are having an alcohol use disorder. And comparing to men, the women that seek medical help when they want either to stop or they want some help with it are less compared to men who seek help. That means like there is a lot of women who are suffering with alcohol use disorder compared to men. The number 3 thing is heart disease. And heart disease here, we talk about the alcohol-induced cardiomyopathy. That's a heart disease which tend the heart to enlarge, to change in shape, and therefore bring some heart complications thereafter due to alcohol use. The number 4 thing is brain damage. When we talk about brain damage and alcohol use, we just need to think about something that the people who can talk about it, maybe they have experienced something they call a blackout. The blackout is caused by some kind of delay of information transfer from short-term memory to long-term storage, and this is in the brain in a place called hippocampus. With that being said, you can tell sometimes someone when they are toxic of alcohol, they can do something, and then when you talk about it tomorrow, they cannot even recall what happened. That is because there was a blackout of any information that was supposed to be transferred from short-term memory to a long-time memory. And that has happened, and maybe we can attest to that. The other thing is about the liver damage. When we talk about liver damage and alcohol use, we can attest that liver damage can occur with maybe liver cirrhosis and some alcohol associated issues that damage the liver and bringing hepatitis and hence liver cirrhosis. And sometimes it can go to maybe even liver transplant if the liver is badly damaged with alcohol. And we need to understand that the liver is responsible for hormonal imbalances, hormonal receptors, and also it's also associated with at least making the hormones do or function in the level they are supposed to function. And when we talk about hormones, here we are talking about the sex hormones. And the reason as to why we want to be crucial on this part of the liver and sex hormone imbalances is because our sex hormones, especially as women, or estrogen is our main component of the sex hormone of a woman. And this component, or estrogen, or the hormone or estrogen, is controlled, reabsorbed by the liver. So if the liver is malfunctioning, that means it will not function in a better way to absorb these, and these will make this or estrogen to be a lot or increased in our bodies, and hence there is a risk of breast cancer, which study and research has that breast cancer is caused, and there is a risk of increased estrogen in our bodies causing breast cancer. So as we think about breast cancer, we think about the malfunctioning of the liver, which is not reabsorbing the estrogens well, and hence there is an increase of this estrogen in our body system, and hence the risk of breast cancer. So as women, that is a very crucial information that we need to do more research on, and what happens with all this. The other thing is now with the liver damage that causes the breast cancer. What do we understand with that as women? 5% to 9% of women who drink alcohol a higher chance of developing breast cancer than them that do not drink. Very crucial. And when we take it back, we are taking it back to the liver malfunctioning or the liver damage caused by alcohol. So it is good to understand that the liver malfunction is connected to increased estrogen levels, which are risk of breast cancer, and we need to be careful of that. The other thing is about alcohol and pregnancy use. Alcohol use and pregnancy. At all, research says there is no safe amount of alcohol use during pregnancy, and this is for the people who are pregnant and also anybody who is intending to get pregnant. Stay out of alcohol, and for this reason, you save good health for your kid that is unborn. Because for alcohol use, there is a lot of children exposure before birth to birth defects, behavioral problems, and also there can be some complications of fetal alcohol spectrum disorders which the child can be born with. So it is always good, if you're intending to get pregnant or you're pregnant, stay away from alcohol, and these will save some health issues to your unborn baby, and you live a happy lady watching your kid grow, knowing that you did not contribute to any defects or anything that can come health-wise with your growing child. Otherwise, we should be careful about alcohol use in women, and we continue doing more research because we are living in a world whereby things are changing day and night. Otherwise, God bless you as you watch this video. Thank you.